Dear friends, hello again. This is, as always, your favorite doctor, Alex Goldfarb. I'm still sitting in the quarantine in the hotel. After my last video, I got a lot of phone calls, and I really appreciate your concern. But I'm doing good. I'm very healthy. I still run 40 miles a week. I work a lot, admittedly. I work probably close to 80 hours a week for the ICU, and then I have full-time job with Akebia, but that's okay. That's what I love to do, and I really cannot complain. I'm still working on the book that I'm going to finish within the next couple of weeks, hopefully. It's a critical care medicine book, and I'm getting involved in a legal case as an expert witness, which is very, very exciting. Let me just say, it's a bad virus. If you're President Trump, you'd say it's terrible, total disaster, which is true. It was called SARS, severe acute respiratory syndrome. That implies that it affects your respiratory organs, your lungs primarily. But as we learned more about that, it seems that it does much more damage than just respiratory failure. Apparently, a lot of people present with kidney failure. It affects kidneys. It affects your brain. A lot of people present with loss of smell and loss of taste, which sometimes is not bad. Some people actually present with encephalitis, direct invasion of the brain. A lot of people that we intubate and sedate, when time comes for their extubation and getting better, and we stop sedation, they wouldn't wake up. It affects your heart. There's patients who present with myocarditis, and most of the patients present with elevated troponin, which is a cardiac enzyme that is a sign of myocardium damage. A lot of people present with abnormal liver tests. Many patients have the hypercoagulable state. In other words, they're prone to forming blood clots, and that might be a sign of vascular disease. So maybe virus affects the blood vessels, causing what's called thrombotic microangiopathy. It is very likely that it affects skeletal muscles and bone marrow. A lot of people have severe anemia, otherwise unexplained, profound anemia, leukopenia, lymphopenia. So the virus gets to the cells through ACE2 receptor. So whatever cells, I guess, express this ACE2 receptor might be affected. What can we do about that? Unfortunately, at this point, not much. Until we have effective antiviral or vaccine, or maybe convalescent plasma. I think it's pretty humbling to deal with this little virus that turned the world upside down. Every person in his or her lifetime have challenges that sometimes help to get out of comfort zone, reevaluate your life, establish your goals and values, and it's sometimes painful, but it's very helpful as far as redirecting your life efforts. Maybe same for the society. Maybe this is the time where we need to do some soul searching and explore our values and see what are our priorities. Would you rather spend money to pay Hollywood star, or you would rather pay the nurse, this girl next door, who works in the hospital where you might be hospitalized, and make sure she's not overworked, she's well paid, not burned out, and when you're there, should be capable to take good care of you? Would you rather support your local hospital and your local business, or pay WHO for their useless efforts to contain these epidemics? Would you rather pay for political campaigns or give money to the families directly affected by this disaster. People who lose money, lose businesses, or God forbid, lose their families.